Greetings to everyone. Today, I will provide information to couples wishing to have children based on scientific data and guidelines prepared in light of my 21 years of experience as a specialist in reproductive health, in vitro fertilization, and medically assisted reproduction. The pathway to increasing the chances of conceiving naturally requires lifestyle changes, understanding menstrual and ovulation cycles, and sometimes seeking medical advice. In detail, firstly, understanding the women's ovulation schedule and timing is essential. Tracking ovulation can often be achieved using prediction kits that work with urine samples, monitoring body temperature, or observing changes in the woman's vaginal discharge. During ovulation, a woman's body temperature increases by about 0.5 to 1 degree centigrade. Vaginal discharge becomes thicker, transparent, and stretchy, similar to egg whites in consistency. Identifying the most suitable time for conception can be determined this way. Observing at least one of these signs indicates the woman's fertile period, during which sexual intercourses every 1 to 2 days is recommended. If menstrual cycles are regular and ovulation dates can be roughly predicted, engaging in sexual activity every other day from 5 days before to 5 days after ovulation can maximize the chances of natural conception. Maintaining a healthy lifestyle is often overlooked, but is central and fundamental to reproductive health. Attention should be given to a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, while avoiding excessive caffeine and alcohol intake. Such a diet can help maintain a healthy weight range. Both underweight and overweight conditions can negatively impact fertility. Your body mass index should ideally be between 18.5 and 24.9. It is important to note that both excessive thinness and overweight are two extremes that directly affect fertility. Regular, moderate exercise can enhance fertility in both men and women. However, please remember that strenuous activities may have the opposite effect. A foundational principle of a healthy lifestyle is to avoid harmful substances as much as possible. It is well established that smoking is extremely detrimental to both male and female fertility. Similarly, even moderate alcohol consumption can adversely affect female fertility. The harmful impacts of drug use are likely self-evident. Such substances significantly disrupt ovulation and egg quality in women and severely impair sperm quality in men. Couples wishing to conceive often encounter high levels of stress due to the fast-paced, demanding work and economic conditions of modern life. Therefore, managing and reducing stress through practices such as yoga, meditation, and other stress reduction techniques, or by seeking counseling services, will facilitate conception. Another critical consideration for men is to minimize exposure to heat as much as possible. Hot baths, saunas, and tight underwear can increase testicular temperature and negatively impact sperm production. In conclusion, by understanding and monitoring ovulation, adopting a healthy lifestyle, and making necessary lifestyle changes, couples can significantly increase their chances of conceiving naturally. It is also crucial to seek medical advice when needed to address any underlying issues or to receive professional guidance on the journey towards parenthood. If you follow all these recommendations and still do not achieve natural conception, you may wonder when to seek professional help. In women under 35 years old and pregnancy has not occurred after 1 year of regular unprotected sexual intercourse, I recommend consulting with a specialist in reproductive health and infertility. If the woman is over 35 years of age and pregnancy has not occurred after 6 months of regular intercourse, my advice remains the same. When consulting with an obstetrician and gynecologist, you will be required to undergo certain basic tests. These basic tests include semen analysis, ovulation tests, hormonal assessments, ultrasound imaging of the female reproductive system, and hysterosalpingography, which provides X-ray images detailing the structure of the uterus and bilateral fallopian tubes. If any issues are identified during these tests, it is advisable to promptly consult a specialist in reproductive health and assisted reproductive technology. Such specialists can offer a more comprehensive evaluation, detailed information on treatment options, and probabilities of achieving pregnancy, thus safeguarding you against unnecessary expenditure of time and money. Regarding treatment options, the most effective approach is to address the underlying causes, moving from simpler to more advanced treatments as necessary. For ovulation-related issues, medications such as clomiphene and particularly for patients with polycystic ovary syndrome, letrozole, can provide solutions under the supervision of a fertility specialist. Should there be a structural problem, such as endometriosis, endometriomas, uterine malformations, fallopian tube blockages, or hydrosalpinx, meaning fluid-filled sacs in the tubes, surgical intervention may be required. In cases of mild sperm abnormalities, intrauterine insemination, also known as artificial insemination, can be performed. This involves tracking ovulation and injecting sperm directly into the uterus at the optimal time. If pregnancy is not achieved through these relatively simple methods, or if the couple's situation warrants it, in vitro fertilization should be considered as the next step. Consistency, patience, and obtaining appropriate medical guidance when needed can significantly enhance your chances of building the family you dream of. Wishing you all a good day.